बिस्मिल्लाहिर्रहमानिर्रहीम। डॉक्टर हुसैन बशकोलाची यूट्यूब चैनल से आज हम आपसे मुखातिब हैं। और आप अगर नए हमारे चैनल पे हैं तो इसको ज़रूर सब्सक्राइब करें। हम हेल्थ के और मेडिकल के जो करंट इश्यूज हैं उस पर बात करते हैं। आज का हमारा मौजू है इंटरनेशनल हेल्थ डेज, जो कि मार्च और अप्रैल में तीन इंटरनेशनल हेल्थ डेज आ रहे हैं। एक तो ट्यूबरक्लोसिस वर्ल्ड ट्यूबरक्लोसिस डे है। एक 7 अप्रैल को वर्ल्ड हेल्थ डे है। और फिर 24 या 23 अप्रैल को हमारा वर्ल्ड मलेरिया डे है। तो ये तीनों बड़े अहम इश्यूज हैं जिस पे हम बात करेंगे। और ये प्रेजेंटेशन हमने 21 मार्च की इसरा यूनिवर्सिटी में तीनों डेज जो है वो मनाए थे, जिसमें हमारे इंटरनेशनल स्पीकर डॉक्टर अयाज समदानी साहब और इसके अलावा यूएसए से और यूके से डॉक्टर हैदर अली टालपुर ने खिताब किया था, और कनाडा से डॉक्टर नासिर जमाल पठान थे। इन्होंने अपने ख्यालात का इजहार किया था। और ख़ास तौर पे डॉक्टर अयाज समदानी साहब ने जो ख्याल किए थे वो उसमें आर्टिफिशियल इंटेलिजेंस का बहुत बड़ा रोल है, जिससे हम ना सिर्फ ट्रायल कर सकेंगे लेकिन हम फ्यूचर की ड्रग्स को जल्दी बना सकेंगे। और ये एक नई दुनिया जो है वो डेवलप हो रही है इन द मेडिकल अरीना। तो अपने टॉपिक पे शुरू करते हैं कि पहले जो है वो ये टॉपिक इंटरनेशनल हेल्थ अवेयरनेस एंड रिसर्च सेमिनार है। उसके बाद आप देखेंगे कि ये तस्वीर है जो कराची में ओझा चेस्ट डिजीजेज इंस्टीट्यूट ऑफ ओझा टेस्ट डिजीजेज, जिसको ट्यूबरक्लोसिस अस्पताल भी कहा जाता है, और जहां एमडीआर के केसेस थे वो बहुत सालों से ट्रीट हो रहे थे। और दिस इज वन ऑफ द बिल्डिंग, एंड यू कैन सी दैट दीज आर ऑलमोस्ट 100+ एकड़ इंस्टीट्यूट। और आजकल इसमें डॉ इंटरनेशनल मेडिकल कॉलेज भी है। एंड इंटायर पाकिस्तान, ईरान, अफगानिस्तान people are coming to the OJA center. This is one of the WHO recognized center, and I served there in 2011-12. And every day I used to see the patients and their condition. In the early morning, 5 p.m., 6 p.m., patients were reaching there, waiting for their turn. And it is a very um, spacious but very important center in South Asia. It was established in 1943 by Deep Chand Ojha, and this served not only the Karachi port city but the subcontinent pre-partition. And this is the picture of Mr. Ojha. We pay great tribute to that. And then coming to the next slide, this is a book which is title is Mr. Jannah and His Secret Battle Against the Tuberculosis, written by Dr. Eli Baksh, Colonel Eli Baksh. And he remained to till the last days, uh, and actually served and took care of the Dr. Qaid-e-Azam Muhammad Ali Jinnah. Colonel Eli Baksh is one of the revered physician of Pakistan, and he has written this book, and that was forwarded by Fatima Jinnah, the sister of Qaid-e-Azam. This shows that what was the difficulties on the 11th September, on the last day, 1948. Even the ambulance was in trouble because of that, some difficulties. Illness is a part of our survival, and living, whether animal or humans, get ill due to various reasons. So morbidity is the condition or state of human being uh, surviving a disease or medical condition, while mortality is upon. This is tuberculosis data. This shows that due to efforts of awareness and international efforts, 75 million, more than 7 crore people, they have been prevented or saved at the global level to get the infection of the tuberculosis. And you can see that in 2022, 10.6 million people fell ill or suffered from tuberculosis. And out of this, 1.3 million people died due to this killer disease. This is a universal health coverage picture which shows that even all section of the society, whether they are disabled, special people, old age, pregnant ladies, who are rich, they should receive the primary health care without any financial hardship, and it should be quality and every time, everywhere health care. This is a very important slide which normally shows the statistical value of the life, or SLV. This is a new term which has been reported in the United States in the medical economy, that the economic cost of the life is almost 5 million, more than 5 million US dollars. So saving one life is basically giving back to the economy about 5 million, and losing one life is about losing the 5 million US dollar, which you will convert into Pakistani, Irani, or the Indian currency, then it is a huge amount. This shows the malaria situation of Pakistan, and mosquitoes, particularly the diseases, common diseases in Pakistan. Number one is malaria, second is tuberculosis, third is hepatitis, fourth is diarrhea, respiratory infection, sixth cardiovascular diseases, seventh cancers and diabetes. So you can see the top are the communicable diseases. The primary health care and universal health coverage basically gives you a kind of the idea that you can have all the health care activities at the house level, at the Kachi Abadi levels, at the village levels, and even you can see that these kinds of prenatal, antenatal care is also important. Birth rate of Pakistan is 25 per thousand people. And if you compare it with the Iran, then it is a 10%, 10 per thousand. So that shows that how Pakistan is needing a family planning and reproductive health care. Iran is a Muslim country where the birth rate is 10 per thousand and we have 25. So almost more than the double. So this will increase the population and all other environmental and social issues. This is one of the Science Daily slide which shows that in the world, 95% of the world population has been with the health problem, and over one third or a third of it is almost to the billion in terms of the calculation, 2.3 billion people. And they also had more than five problems, not only one single problem. So we need to have a universal health coverage. Otherwise, we will not be able. Another is the medical errors are the third leading cause of the death, and other statistics you would question. So medical error should be reduced, and in Pakistan, little awareness is about the medical error. And the main reason of the medical error is communication breakdown between physician, patient, paramedics, and the community. Physician should be smiling and should be friendly and should have a heart-to-heart communication. So this also shows that Pakistan needs everywhere healthcare facilities so that the uh, population, which is the sixth largest country, and we have about 230 million population can be. This is tuberculosis, which is droplet infection. Coughing and sneezing is the main reason. And so I can give you statistics that the coughing and sneezing speed is almost equal to the electricity. And one of the statistics by the Economic Forum, I have heard and seen that the speed of the coughing and sneezing is 160,000 kilometer per minute or per second. So you can understand that the million of the bacteria can be spread by sneezing and coughing, and within a 7 hours, the one bacteria can develop almost 1 million bacteria. So within 7 hours, a whole city or people of area can suffer from this. This is the a picture of the tuberculosis showing the pathophysiology or the internal damage caused by this bacteria, Mycobacterium tuberculosis. The lungs are affected. This you can see both the X-rays. One is with the tuberculosis where the lungs of the left side are almost white, and while after treatment, the lungs are full with air and both are black. Black shadow is a positive sign that lungs are functioning because on X-ray, the air comes as a black thing. So you can see the physical happiness. And this is another picture where one after treatment, the how you can bring the smiles, not only health, but a lot of good things to the society and you contribute. And even statistical value of life, I have told that it is about 5 million. And for American, it is about 7 million US dollars. Then you can see that Pakistan with an estimated 500 thousand cases or 5 lakh tuberculosis emerging each year, and about 15,000 are drug resistant tuberculosis, which requires almost 1 million cost to treat a one MDR or drug resistant cases, and we are losing about 50,000 people every year due to tuberculosis. This is the malaria slide, which shows not only the spray and other medical and pharmaceutical interventions are, but there are many natural plants which are mosquito repellent, in which we have Raat Jirani, we have rose flowers, we have eucalyptus, we have ashoka, we have neem tree, and many other trees are there. And these are few pictures which are showing that. So please try make the your city, Hyderabad, Karachi, or Pakistan not only beautiful, but with the mosquito repellent plants, you can reduce the malaria incidents. And in my research, about 60 plants are in Pakistan which can repel the mosquito. So this picture shows that infant mortality, which is sensitive indicator of the healthcare quality as well as the national healthcare services available, and as well as a good economic and health indicator. So in Pakistan, we have 56. This is higher, but it is average because in rural area, it is almost 100, but in urban area, it can be 30, 40. So the average is 56. But when we compare with the Iran, the condition or the IMR, then you can see that their infant mortality rate in Iran is almost 10, while in Pakistan it is 56. This is a maternal mortality rate, which is for Pakistan 150, and let us see in the Iran, it is 22. So look at the neighboring country, which is our next neighbor, next door neighbor, how they are healthcare, because they are implementing primary health care as well as public health care in an effective manner. And Iran is one of the good in primary health care. And we have also lady health workers program. And the same program is in Iran and India also. So where these health workers going to home, now they are creating awareness about tuberculosis and malaria, as it was told by Dr. Mushtaq Shah in the Isra University seminar. This is universal health coverage, simple, just like umbrella. So this should not be into the selected people or selected part of the population, but this should be available to all the people. So universal health coverage means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. So most of the poor people, most of the needy people, most of the people who are at the remote area or out of the center of the country, they need universal health coverage. And this shows that 4.5 billion people in 2021 were not fully covered by essential health services. So out of 8 to 9 billion world population, if 5 billion people are without universal coverage, so what is the condition? And this was one reason that the COVID exposed the world situation where hospitals and the towns, they could not sustain the COVID attack or the pandemic pressure, and many people who could be saved were deprived of the universal health coverage or other health coverage, including the tuberculosis, malaria. This also shows that health coverage, a global monitoring report shows that essential health services are important and 4.5 billion people are in a dire need. And this also shows that 1 billion people, they are paying from their own pocket to get the health coverage. And out of this, 500 million people are going into the extreme poverty, and 10 million people, 10 million means 1 crore people every year are going below the poverty line and with extreme poverty due to paying from their own pocket for their medical and treatment cost. This umbrella you can see is just available to 4 5 people, but we need universal health coverage for all the people, whether rich, poor, urban, rural, every time, everywhere, without any hospital uh, hardship. This is once again the health coverage for all, and primary health care is universal health coverage is another aspect. Without that, why universal health coverage? This is part of the World Health Day theme because health is human rights as per the WHO Constitution, lowers the overall cost of the health care. These are the plus points of the universal health care, lowers administrative cost. You don't require such big hospitals and such technology and such administration. Standardizes services, it gives uniform services and prevents future social cost, more deaths as well as even in tuberculosis. If 1.3 million people are dying, then universal health coverage is the most effective and most relevant and most available health care which can save million of people, not million, but I will say. So look at this, the primary health care or universal health coverage as per the Astana Declaration 2018 and primary health care 1978 Alma-Ata Declaration. Everywhere these facilities should be available, and this is essential health care, quality health care. So to build back, WHO says to reorient health system using primary health care approach, most 90% of essential universal health coverage intervention can be delivered through PHC approach. So you can have, and even the life expectancy can be increased by 3.7 years if we will adopt the primary health care, and we can save almost 60 million lives through the primary health care every year. So with this, I think I am concluding some of the important slides, and this is the tuberculosis reminder for you that we can stop TB by providing and tracing contact families, creating awareness. Awareness can save more lives than any other intervention. I was just hearing that if the community is willing, then you can have now at least there are 17 countries or 27 countries where no indigenous malaria case is there, and tuberculosis case is almost 100 per year, and we have 500,000 cases. Thank you very much, Dr. Hussein Kolachi. YouTube channel this special presentation on International Health Days of Tuberculosis as well as malaria and World Health Day. I am thankful that the WHO Dr. Badr Munir addressed this conference in Isra seminar, and Dr. Sara Salman of the WHO Sindh region also sent a message. And I am thankful to Dr. Ayaz Samadani, Dr. Haider Ali Talpur, and other present from the Director General Health Government of Sindh, Dr. Waqar Ahmad, the Director General, and the representative, Dr. Sambreen Ashraf, Dr. Syed Dabira Ahmad, and Dr. Mushtaq Shah of Director Malaria. They were present, and even IRDP, International Research and Development, conducting the trial on the MDR under the Medicine Without Borders or Without Frontiers. Their representative, Dr. Sunita, also participated, and from Hamdard University, Ms. Alia Nasir, and from Bilawal Medical College, Dr. Nudrat and other teams were there. Department of Community Medicine has established COVID vaccine center, rabies vaccine center, tuberculosis diagnostic and treatment center, and as well as the hepatitis treatment and diagnostic center. All these facilities are free with the cooperation of Government of Sindh and other donor agencies. Isra University is providing the facility and the manpower to these, and one of the best tuberculosis diagnostic center is considered Isra University, because we have diagnosed one tuberculosis cases suffering from the eye infection, which was from the tuberculosis, and other brain tuberculosis within our own setup, and they are treated, and now they are having a good life. So Dr. Hussein Kolachi is thankful to the provincial program officer, Dr. Sharif, who actually participated in the days of the earlier days of our awareness program in tuberculosis, malaria, and other days. And ultimately, we have a diagnostic center. Thank you very much for the office. Yes, I am also thankful to the Dr. Professor Hamidullah Qazi for gracing and chairing the session in Asadullah Qazi Auditorium of Isra University. Dean Basic Sciences, Dr. Asad Jistani, and Dean Clinical Sciences, Dr. Khalid Talpur. Thank you very much. Okay, and